Welcome to Nursing the Future's speaker series. I'm Judy Dukeshire, Director of Nursing the Future, and your host for this particular session. It's my absolute privilege and pleasure to welcome Linda Silas, our President of the Canadian Federation of Nurses Unions. Welcome, Linda.
Thank you so much. A pleasure to be here.
Well, let's just get right to it, as Chris Cuomo would say, Linda. You've been working to advocate for nurses and patients in Canada in various roles for what seems like a lifetime. And in working for the rights of nurses in the workplace, can you share your thoughts on how the nursing profession has evolved over the last decade?
Oh, last decade, because I think you're right. I could go for a lifetime. I started my union advocacy work when I was a critical care nurse in the early 80s in Moncton, New Brunswick. So thinking of what's happening with COVID now brings me back there. But if I look at the last decade, I would put it in two parts. Really, nursing as a profession, we've evolved. We have our place in society. We have a profession that offers 100+ types of jobs. When you think about it, you can go work in pediatric, or you can be a PhD like you teaching, or never mind teaching, you're starting new programs, new evolutions, or we have administrators, we have home care nurses, we have mental health nurses. Like, it is so vast compared to the 1970s, 60s, 70s, etc. The second part is the nurse herself, himself, or they, where it's been a moment of enough. We have been hit with shortage in the workplace before the pandemic. We can't blame everything on the pandemic. And we're hearing the voice of nurses, regardless of where she or they work, everywhere. Enough of the bad working condition, enough of not having full-time jobs, enough of having a full-time job that doesn't permit me to be there for my children's birthday or my son's graduation, or because there's so many life's events that we have missed. We take that as accepting being a nurse, and especially working 24/7, but there has to be a better way to have a workforce that is safer and a workforce that is more satisfied than currently nursing is. So it's twofold. The profession has done amazingly well. The workforce itself, the nurse, the individual, is waking up and speaking. And you might remember, see, now I'm thinking out loud, Judy, and that's dangerous. But remember in the 1990s, we were talking about that sleeping giant waking up? And we're describing nursing as that. Well, maybe the sleeping giant stood up, and as a profession, we're standing strong. And now the giant is really speaking up.
So when you say the giant's speaking up, Linda, I mean, what are the risks of not being heard?
Great question. The risk of not being heard is others will replace us. The risk of not being heard, and I'm talking as nurses now, is we will have either other professional, other workers doing our work. And that we did it to ourselves in the last shortage of nurses we had, which was the end of the 1990s, early 2000. Every tribune we were on, we were saying, we need help. We need a warm body. We need help. And we quickly realized, yes, we need help, but we need help that is able to provide an answer to the patient's needs and acuity. And there has to be a right balance. Doesn't mean there has to be a registered nurse everywhere, every time, all the time. But as many say, the sicker the patient are, the more qualification the nurse team needs to have. And that we need to stay strong. And I think today in 2021, we're seeing a profession, but we're seeing individuals saying, yes, I need help. We're working short, but we need the right kind of help, and we need to work as a team.
Yeah, excellent points as always. Now, that's a good segue, really, Linda, into what we think new graduates need. You know, what strengths do they offer the profession? But then again, what supports do we need to put in place to optimize their transition to practice? What are your thoughts on that?
Before the new graduate, it's never forgetting that excitement of being a new graduate. That excitement of when you're going to pass your NCLEX, when you're going to stand proud as a registered nurse in this country. And it is so important because you're entering a profession that is the most respected, the most loved. You know, we're being called heroes everywhere, which I can get on that later, but we are a respected profession. We are called to certain kind of duty, but we're not angels of mercies. And we have to accept that we need to speak up sometimes. And for new graduates, just like we both were when we were 21, 22 years old, graduating and we'll conquer the world, we sometimes forget to ask questions. Every new graduate I meet, when I meet the fourth year classes across the country, I tell them you have two things to protect. One is your back. And what I mean by that is your health, your physical and your mental health. You really have to stay healthy. Nurses should be the healthiest workforce, not the sickest. And sadly, we're the sickest. And the second is your license. And to protect your license, because even if you don't lose your license, if you get disciplined, there's always that mark on you. You have to protect your license by your respecting your code of ethics, of course, but also respecting the guidelines within the work place you work. And that can be from mental health, home care, long-term care, and acute care to intensive care. You have to respect those. And if you don't know something, you have to say it. Tell your supervisors, your colleague, I don't know how to do this. I need help. Ask the questions. And I've never met a senior nurse that will let you drown. We might be rushed, but they'll help you. So protect your license by asking questions, asking for help, and protect your own personal health, both physically and mentally. And you'll go into a lovely career, like both of us have went to lovely careers that brought us to paths that after they think, I don't think I would have thought I'd be there many moons ago.
Great advice. So let's move on to the nitty gritty of our current situation. We can't obviously avoid talking about COVID-19. I'm wondering, Linda, how has this pandemic impacted healthcare and the nursing profession from the lens of nurses' safety in practice? And what role is CFNU playing in supporting nurses through this crisis?
So for CFNU, it's really taking the Band-Aid off a dire situation in mostly in our acute care sector and into our long-term care sector. We did many reports in the past, and people say, oh, everyone's talking PPE now, personal protective equipment. Everyone was talking PPE in 2003 when we had SARS in Toronto and Vancouver. Everyone was talking PPE in 2009-ish when we had H1N1 and then right after that, Ebola. But even in 2009 and 11, nurses were telling us, it's not comfortable. All the PPEs, it's not comfortable. Because we forget that we're not angels of mercies. We're not super people. We can get sick. And we don't think of ourselves as a worker. And I go back and I try to compare nurses to construction workers, to firefighters. You would never see a construction worker walk on a work site without the proper equipment to protect him or her. You would never see a firefighter jump into a fire without the proper PPEs to protect themselves. And we're asking nurses, we're asking healthcare workers, trust us.
Mhm.
You don't have to worry. That has changed. And that, if I just look at COVID since March, I see the giant I was talking about standing up, but being louder than ever on the PPEs. And what CFNU, the only thing really we did is tore the bandage off and kept it off and reminded nurses on and healthcare workers, because we're all working. This is healthcare is the biggest sport team there is. We have to work together as a team. And we all have our little battles, this is my part of my job, my duty to care, etc. But at the end, we all have to work together. And when a crisis like the pandemic hits us, and the fact that our coworkers are getting sick, that our family members are getting sick, and sadly, some are passing away with this virus, we're saying, okay, we all need to protect each other. And the whole safety in the workplace, the occupational health and safety is become a number one priority. And that is so important and it has to continue.
So I'll have you expand a little bit more, if you can, on the impact you think COVID has made on healthcare in general, and maybe how that is influencing where nurses work, how nurses work, and where the new graduate might fit in
Interesting. I wish I could have a crystal ball
that.
because no, but I do believe that healthcare as a system is at a pivotal point. And sometimes it takes traumatic events like a pandemic to change. I look at our colleagues working in public health and mental health. They're going to be at the upfront of anything we're going to do. We will need to look at public health, the prevention of our health, both physically and mental health, as we've never looked at it before. You and I were talking just before we started the interview, how frustrating it is for intensive care nurses of having people who, for whatever reason, don't respect the public health measures and just enter our hospital system and say, take care of me. That is changing dramatically. The system is moving dramatically, and we're realizing we need better measures in public health and in mental health. And then our long-term care, I shouldn't say and then, because we've known in our long-term care sector that we needed to change and increase the level of care across the board for years now. So all of this will change. But the crystal ball, I don't know yet, but I do know that as a society, we're going to have to take better care of ourselves, both physically and mentally, and better care of our communities. And that's the whole public health restriction, public health awareness that we're going to be bringing. And our members are the best advocates to do that. Nurses are the best advocate. Regardless if you work in an intensive care, long-term care, or have a job in public health, we all know what to do to stay healthier. We all know what to do to protect our families and our communities. We will just need to put a megaphone on and yell it even louder. And I think that's where government are really waking up now and saying, who are we really listening to? Who did we listen in the last 10, 20 years when we reform healthcare? Did we listen enough to the nurses? And I would say today, no, they didn't. But starting in 2021, 2022, they will have to, because we will have to bring a system back to the basic, which is preventive health, health promotion, taking care of our seniors, taking care of our basics, and making sure we have the best acute care system there when we have failed the health promotion items.
Yeah, it's interesting. I was talking to a nurse practitioner colleague and friend of mine yesterday evening, and she was talking about how in their intensive care unit, they had come so far in sort of advocating for patient first, patient safety, but family involvement. The idea of not over sedating patients so that their experience post ICU was not one of PTSD, but rather that they were involved in their care and that it was a less of a traumatic transition. But with COVID, that went south, and now it's all propofol versus, the items that we need to ensure that we can actually care for these patients who are frightened, can't breathe, are agitated, and whatnot. So she's almost concerned that COVID has introduced a layer of urgency and emergency that puts aside some of the advances that we've made in the way that we focus on care. And she's concerned that advancement isn't going to come back once COVID's gone. Do you see a decent recovery plan in place for our post-COVID return to better care practices and better safety for nurses in the workplace? Do you see it happening after the urgency and emergency of COVID is gone?
Yes and no. I think researchers like yourself will have a field day of everything that will be able to be analyzed and studied. I think I mentioned it earlier. I started my career in intensive care. Back in the days, there's not one patient in intensive care that remembered what happened to them in intensive care. And that was purposely. It changed. How will it be in 5-10 years? That I don't know. It's way above my pay grade. But what I do know is the aspect of nursing care will be looked through a different lens. The impact that nurses do in intensive care or in the community will be looked through a different lens. What we need to do is to make sure that it's not watered down. Because my biggest fear and what keeps me up at night is not as much as the debate on if a patient will be sedated during certain treatment or not. That is way above my pay grade. But it's, will we have enough nurses to serve our communities? Will we have enough young people or not so young people enter our beautiful profession? Because I still think even 10 months into a pandemic where my members are sick or exhausted, they just can't handle it anymore and they still go to work, I still think we have one of the best professions in the world. But I'm worried that we will have such a shortage of nurses because the sick leave will be dramatically higher than it's ever been. And we already have the highest level of sick leave in any workforce there is. That was pre-pandemic. In mental health issue, we surpass police officers, paramedics, military in mental health incidents or illnesses because of the stress level. So that's all pre-pandemic. So can you imagine what's going to happen post-pandemic when again, researchers of the world are going to study us? So what we need to do as a collective, as a profession, is not to water down our principles, not to water down the years and years of experience of research that talked about the quality of care, the quality and the importance of secure patient care has to be matched with secure nursing care. We have to stay strong on that. And us as unions, and I'm talking to all the union goons across the country, because it's not only nurses unions, it's every healthcare unions is saying, okay, how do we reshape the workplace that everyone wants to come here? Because we want workers to come and work with us and to be attracted to nursing and to be attracted to all the healthcare professions. It feels good when a prime minister stands up at noon, and I just watched Prime Minister Trudeau talk again and thank all the healthcare workers for their work and the essential workers. You know, it feels good, but feeling good won't keep us in the profession. It will be the great jobs, the flexibility, the decent and respectable salaries, vacation, etc., and great pensions, of course, which we will work on. Long answer for your short question, but summarizing it, it's we can't back down on what we've learned in the last 30 years on the need for safe staffing, nurse-patient ratio, the right nursing workforce, and two, we have to work on health, human resource, retention, recruitment, and that will be urgent.
Yeah, that's just so true, Linda. I think about the new nurses out there that just don't have the kinds of skills that they need to navigate the incredibly flexibility, dynamic, and acutely changing nature of practice that's out there right now. I worry that the interface of the new nurses with these very exhausted um, team players, but tired team players, what impact that's going to have on their understanding of themselves as nurses and their progress in the profession and their feelings of empowerment and the ability to actualize the kind of practice that they want to. I worry about them. And I'm just wondering, you know, just from your experience, what supports do you think those new nurses need in the workplace to be safe and to be healthy in their practice?
You see, Judy, I'm nervous about it, but at the same time, we can go back not that far in history when we were looking at the new grads, where we created supernumerary positions, where we created different organizations to help them, where we brought back retired nurses to be mentors. That was all done from 2000 to 2008. And 2008 is when we hit the last recession where everything crumbled down. But those 8-10 year period, employers knew the richness of the nursing workforce, but they also knew the shock of graduating from a university program and entering a hospital or long-term care facility, and they were putting the resource. So we've tested the solutions for 10-year plus. We need to bring them back forward. We need to find a way that a new graduate doesn't say, I cannot handle a full-time job. There's no reason that a 22, 23 years old cannot work 35 hours a week. On average, maybe 37. That's a full-time job in nursing in Canada. 90% are unionized. So we're not talking the 50 hours a work week here. So it is important to work, but it is those supernumerary, it's those permanent positions, it's these clinical ladders that we've looked at in the past too, to make sure that our workforce is well surrounded. Because if they're well surrounded, they're also providing excellent care to patients. So it balances out. And the less incidents, patient incidents that happen, the less the costs go down. And we've had many studies explaining that. The more nursing you have in your workforce, less patient incidents, and your costs go down. So really what you pay to have extra nurses, you're saving money in the long run. So we've seen also different programs. I hate to say it was during the Harper year, so that's even the scarier. But it was clinics for orthopedic clinics. We had pilot projects in Calgary. We had some in Winnipeg, where there were wait times for surgeries, mostly orthopedic surgeries. And the federal government gave 2 big pilot projects and said, okay, reduce the wait time for hip and knee. Just go at it. And they established within our public sector, within our hospital, clinics for hips and knees, where they had nurses do pre-op to follow up, post-op follow-up, they had physios, pre-op, post-op, patients were in and out, blah, blah, wait times went way down. So when you hear surgeons, when you hear the system or ministers of health saying, oh, this pandemic is creating a lot of wait time, in which I agree, there are ways by working as a team and putting everyone, including a new graduate, well supervised, of course, or well mentored more than supervised, because they're fully grown and fully graduated, well mentored into a system that will help our prevention, our health promotions, but also the wait times that is looming among us.
Well, that's a good segue, Linda, into a slight deviation in our conversation to the idea of recognition, visibility of that recognition, and tangible support for nurses in Canada. I'm just wondering, what do you think needs to be done? What is being done to ensure that that nurses are recognized and moving forward are heard at the level of decision making, whether it be institutional, regional, provincial, and national?
Well, national, we need a chief nurse. We're one of the only country in the world that doesn't have a chief nurse of the federal government. We used to have one, and I've said it numerous times. The federal government, over the years, because it's more than one government, was very smart. They just bit little bites of that position gradually, so we really didn't notice, and then poof, it was gone. And why we say we need some kind of national coordination is we need exactly that, a national coordination. Even if we're a humongous country in landmass, we are still a very small country in population. And you cannot be creating too many nurses, if I use the example of nurses, in one province when there's a shortage in another. We have to have some kind of matching. We also have to have the best practice of the world collected together and be able to test it in Canada. That's big picture. Big picture is also organizations, nurses as a whole. We need to regroup. We need to be on the same page. You mentioned earlier when you introduced me, I've been doing this advocacy world for 1,001 years, and it's true. The biggest frustration is how we're all in for a 30-second time of fame, and we give different messages. I have no problem with organization getting a limelight, but even if we use different language, we have to have the same goal, the same outcome, and that is regrouping. And nurses, our joint membership, because there are many organizations out there, are going to force us to do it, because we're asking them to stand tall, to stand strong, to be vocal as healthcare professionals. And they're going to look at national organization, provincial organization, regional organization, and say, you guys get your act together. And that will help us advance our agenda. Similar to look at this pandemic. Is there something more frustrating when you hear the federal government saying, well, really, it's the province's fault for the vaccination is not being delivered as fast. The province are saying, I don't have enough vaccination. Then the mayor of a city saying, what about me? What about me? All of these interprovincial municipality bickering is not helping anybody, but the same thing in healthcare or in nursing. All of these powers struggle from either on the unit level or within organizations like myself, doesn't help.
Yeah, absolutely. I totally agree with that. I think that we all need to leave our silos and come together, be thinking about how we can help each other. Absolutely. Thanks for that comment. So maybe I want to take it a bit more specifically, because some of the members in Nursing the Future have voiced concerns that provincial and or national politics are challenging our historical understandings of an accessible, publicly funded healthcare system. I'm wondering if you
Mhm.
can talk, maybe to start with, Linda, on how accessibility and our ability to serve the marginalized populations like rural and remote and indigenous communities, how are we serving them now? And how can nursing affect positive change in this area?
Mhm. I'm glad you mentioned the accessibility to our public health system. And we need to remind ourselves that there are no better guardian of our national healthcare system than the nurses of this country. There was none when we started the Canada Health Act. We were the strongest defender and promoter of an act, up to the point then when we got a universal public system in the 60s. Right now, it's all about a national pharmacare program, a national long-term care program. We've talked about mental health. So on the big picture, nurses as a workforce, as a push, have been the greatest guardian. When we look at individual examples, like you've said, for rural or remote, for indigenous communities, we can't brag too much. They are champions in those communities that are nurses, some are physicians, some are other healthcare workers, and they're really champions. They're really fighting tooth and nails to keep the community safe. What we haven't done as a collective is how do we all help? And we've established projects before. I know for CFNU, we had worked with the nurses in Nunavut. We matched them with nurses in Ottawa to do online training to each other. And probably the pandemic is going to open that up because we've had to do virtual everything. So you're going to see more interchange, and that's what we have to do, more interchange, more education of each other's values, cultures that we don't know. I was with the nurses in Quebec earlier last week, talking about the Jordan principle, which is the principle for children living in Indigenous community to get the right to access to healthcare, mostly home care, just like any other Canadian. And that's been going on for 20 years. We're still talking about it, still being debated in the courts. And these were all new graduates, and they were saying this doesn't make any sense. And then we talked about the principle of Joyce Etcherson, the patient that died in the hands of racist nurses in Quebec, or in the north of Montreal. And they're establishing a principle similar as what all of us had done 20 years ago for Jordan, who was a child. So you're seeing these movements still within our community. But what makes me so proud is nurses might be at the center. For Joyce, it was at the center of racism, and racism do exist in healthcare, was there, but we're part of the solution by educating each other, by understanding what is rural and remote nursing. I've never worked there. I've been there. I've seen it with my two eyes. I've been amazed on what they're able to do. But we need to take that knowledge and bring it downtown Toronto, downtown Vancouver, downtown Calgary. For whoever is making those decisions, they need to see it and how we're all linked together. And I think the virtual world, the internet, the plain old telephone system will help and will give us more security than we've ever had. And that COVID, that will be a gift of COVID. I don't know about you, but I've had a couple of appointments with my nurse practitioner since all of this has happened, all by phone. She offered Zoom. I said, no, I do enough of those, but all. And that is impressive. You know, okay, Linda, you need to check your cholesterol again. Okay, which lab do you want me to send this? Everything's done electronically. Before, it would have been 3 visits. We found a way to reimburse this also, because that was a problem before. So I'm very optimistic for rural and remote, for our indigenous communities, especially the very remote, because all this technology will be opening up and will be made available because people will make it sure. And if I can give an example, look at the vaccine, how even the Prime Minister is talking about how we have to make sure that we find ways to bring this very delicate vaccine to very, very remote communities. It can be done during a pandemic, and it will be done after the pandemic.
It has to be.
Yeah.
It
Yeah.
has to be.
And we as a collective have to be part of those discussions and part of those solutions. Again, when I say part of the solution, doesn't mean that we're 150% part of the solution, but it means that the nursing component is ours, and it is ours to protect and expand into these types of nursing. And I can see many, many young nurses wanting that excitement. What we have to make sure is when we plan for health human resource, yes, it's quite exciting to go work in Nunavut, to go work in the north of the Northwest Territories, a beautiful Yukon, or even rural Saskatchewan or Alberta, or there's so many beautiful areas. But those communities, it's their life.
Mhm.
So there has to be a balance of bringing fresh blood, if I can use that, fresh ideas, fresh experience. But how do you continue the continuity of care for them? And one of the best way to do it is train the trainer,
Mhm.
is train the community,
Mhm.
bring them into nursing program, into medical school, and work that way.
Yeah, I've had a few conversations with some rural and remote nurses in terms of how do we use some kind of apprenticeship model in closely knit communities like that, where practitioners have the credibility of the within the community, and how do we have that transfer to new nurses who have that energy and creativity and may want to begin their life and their career in a remote community? How do we support them to be integrated into the community so that the community accepts them? So yeah, there's some great work to be done there. Now, Linda, along that vein, as I make my way toward my final question for you, what do you see as inroads for nursing roles as we move into the future? Are there things that are opening up and you see opportunities for nurses that we aren't currently capitalizing on right now?
Not really, because we're already there. And that was almost your first question. You know, I saw in the last 10 years how, as a profession, we're everywhere. And you know, you have nurses that are deputy ministers, you have nurses that are deans of schools in business, etc. You know, that's outside what we usually think of where a nurse is. So those will continue. I think my biggest fear is we forget that we need 24/7 care.
Mhm.
We need home care. We need long-term care. We need mental health. And those are so rich positions. Uh, all due respect to positions like mine or yours, Judy, but these are very few. We need those that want to commit and bring better care, educate themselves, better certification, etc., to provide direct patient care. And we cannot put a shining light on all these big positions when really what counts and what is rich in our profession is that direct patient care. And that's where we have to put our energy, is making sure that that workforce is satisfied, is well educated and well protected, so our communities are well protected. The rest of us will come and go, and we will continue to exist because nursing leadership is so rich. Everyone wants a nurse on their board. Everyone wants a nurse within their management team because we're quick, we analyze, we evaluate, execute. Sorry, that word is missing right now. As you all know, I'm French, but we make it happen. The logo or the motto at CFNU is where knowledge meets know-how. And for me, the meets know-how was so important because I spent so long in my career reading research papers written by smart people like yourself, Judy, and nobody was doing anything with them. They were all staying on shelf. That has changed dramatically because we take that knowledge and we make it work. We apply it. And when we don't apply it, we start over and we push the agenda. And that's what I'm asking the new graduates, the new nurses in our workforce, and the old ones, what I call the spicy nurses out there too. We have to continue on pushing the agenda because we know how to do it.
Yeah, I think what I was really getting at was because I'm right there with you, Linda. I am absolutely right there with you. I've always wanted a foot in direct practice because that's why we're all here. I mean, when I'm in a classroom or I'm running this organization, the only real point is that we provide supports for nurses who are doing the direct care. They are the most important aspect of our healthcare system, in my mind. So I'm definitely replaceable. They definitely aren't. So I think about areas of practice where perhaps the world is moving. For instance, telehealth. I think that's something that I wondered if you had any inside knowledge on, because I'm thinking telehealth with nursing practitioners, not nurse practitioners necessarily, but nurses as practitioners in a telehealth context. You'd think that that would be starting to expand as a practice, or gerontological nursing, because we are starting to understand the tremendous value of good nursing care for the quality of our elders. So I was thinking really about areas that you think are opening up now because the world is changing, like international health or global health or something like that. Any thoughts on that?
Well, I don't want to say global health or international health because I don't want anybody to leave Canada. We need them all. But virtual health and other specialties already exist. They might be booming into the numbers. But where I think is really going to boom is into the public health, mental health sphere, that whole home care aspect. We're going to keep our specialty into our acute care, which the virtual health is a lot there too. But it's that public health, that health promotion, both physically and mentally. I think that will expand. And it will expand on different front because it will answer to rural and remote and other communities. That's where I see more of the boost. Now, we might do this interview in 10 years and say, you were wrong. Now there are more virtual robots analyzing whatever, not in 10 years, but you know what I mean? Who knows? But I still think it's there. I always said we can increase all the virtual, all the technology, everything we want, but patient care is human care. You need a human, you need that touch. Sometimes it gets very cheesy in ads that, even CFNU does. There's always that hand, that care, that look. But it's because it's so important. Patients go into a hospital long-term care, not for the big surgery, honestly. They go for that nursing care. So we can't forget that. Yes, there'll be all the extras, and they'll be a component. But again, you said it better a while ago. We have to break down all the silos. We all have our expertise, but how do we all work together? And that includes the patient care component.
Yeah, well said. Well said, Linda. So let's maybe end with a larger picture response to the question, what do you see happening in nursing over the next couple of years? Where are we going in 2021, 2022?
I'll go back to when we were talking about working in silos. I think we will need to regroup and regroup as professionals, regroups as decision makers, and we will have to listen to each other better. Might sound motherhood and apple pie, but in the fast track of before COVID, we were forgetting to listen to each other. We were forgetting to listen to the new grads or listen to the 63-year-old nurse that says, I'm really not ready to retire, but please, my knees cannot handle more night shift. We were just working too fast. The pandemic has has stopped us. Now, right after the pandemic, we'll have to refocus, regroup, and say, what do we need as communities? What do we need in healthcare? And what does our workforce need to survive and thrive? And the voice of the new graduate will be so important, because in 20 years, chances are you and I won't be working, and it will be that workforce. So I want this workforce, the new graduates, the newbies into our workforce, to think about it. What do I want in 20 years? When I started my nursing career, I wanted nurses to stand up. I wanted nurses to be proud to be nurses and have rights, and to be able to stand up and without being disciplined by their manager. I remember the days when I was in nursing school, or it was university. It wasn't nursing school. It was a university, where the nurses would give their chair to the doctor when he or she, it was all he's back then, walked in. We don't see that anymore. You see more the doctors giving their chair to the nurses, So we have to really stand up, regroup, and refocus on what is necessary to have a healthy population, both as Canadian, but a healthy workforce as nursing.
I'm often reminded of something that I read in Mike Villeneuve's document many years ago, Nursing in 2020, which is interesting that I'm thinking of it now, where he said, if you don't create it, they'll create it for you. Mm-hmm. And I think that that's basically been the thrust of the conversation today. It is about us as a profession and us as individuals in a collective to make decisions about what is right for healthcare and nursing in this country, and moving toward being at the table, being at the decision-making conversations where those changes are being made and those policies are being altered and initiatives developed. So, I think I totally agree with you, Linda. We need to be in front and center where all of that is happening. So I just want to say thanks, Linda, for this great opportunity to chat with you about nursing in Canada. I appreciate that all of our members have joined us to be part of the speaker series, and we hope that you'll come back next month. Thanks so much, Linda.
Perfect. Thank you. Take care. Stay safe. Stay strong.
Thanks, everyone, for joining us here at Speaker Series. See you next month.